Oral Health and Nutrition's Toothbrushing Techniques. Guidelines to selecting a method. It should be able to remove the plaque from the teeth, but it should not harm the patient's tissues. A disclosing agent helps show the plaque. It stains the bacteria, and it's used to evaluate the effectiveness of the patient's oral care. Patient education. Common areas that are missed by the toothbrush are the cervical areas, that is, along the gum line, especially on the cuspid, as opposed to the opposite side of your dominant hand. Interproximal areas. Distal to the last posterior tooth, especially the second or third molars, and the lingual of the mandibular posterior teeth. Patients are classified into 4 groups. The first group has excellent brushing and flossing skills. We encourage the patient to keep it up. Group 2, they do fairly well, but they skip a few areas. We need to teach them how to reach those skipped areas and to be aware of them. The third group are overzealous brushers. Excellent plaque removal, but they harm the tissues from brushing too hard. This is evident in soft tissue laceration, gingival recession, and tooth abrasion. Erosion is the loss of tooth structure by a chemical process, for example, vomiting, soda, sucking on lemons. Group 4. They do not meet either criteria. Plaque control programs are indicated for these patients. They must be taught safe, effective brushing techniques. On the maxillary, the Bass brushing technique. This is also called sulcular brushing because it's aiming for the sulcus, or that area of free tissue around the tooth. It's effective in cleaning the cervical and much of the interproximal areas of the teeth. We use floss or interdental aids to complete this process. The Bass technique uses a 45-degree angle to the long axis of the tooth and a shimmy in gentle but firm vibratory motion. This forces the bristles slightly into the gingival sulcus. We vibrate about 6 to 10 times before moving on to the next group of teeth, overlapping as we move along. We are horizontal for buccal and lingual aspects of the posterior teeth, and we hold the toothbrush vertically for anterior teeth. A modified Bass technique is like the Bass technique, but then the stroke is continued down over the tooth surface. The modified scrub method. On the maxillary, we're showing a 90-degree angle to the facial and lingual surfaces. Scrub the tooth using small back and forth strokes. No strong horizontal scrubbing, as this can cause tooth abrasion or gingival trauma. The Phones brushing technique. We place the toothbrush against the teeth at a right angle. We use circular motions, beginning at the posterior, moving our way to the anterior segment, and the jaws are kept closed to allow more room against the cheeks. Brushing the occlusal, or the biting surfaces. Place the bristles on the occlusal surface. Scrub with horizontal back and forth strokes. This drives the bristles into the pit and fissure areas. Overlap your brush strokes. Each area should be the length of a brush head at one time. Move on to the next area by 2/3 of the length of the brush head. This ensures overlapping, which helps to prevent skipping of any areas. The number of brush strokes. 6 to 10 strokes on each area is recommended. We suggest that patients mentally count the strokes when they're first developing these good brushing habits. A brushing pattern. Use the same sequence each time to avoid missing areas. We can use the 1 through 32 sequence on the facial, and then repeat for the lingual, and then finally the occlusal surfaces. Don't forget to brush the tongue. Rinsing. An antibacterial mouthwash is recommended, and we do use mouthwash or warm water after brushing to help remove all that debris that we have loosened with the brush and the floss. Thorough morning cleaning, thorough cleaning before going to bed at night, and in between we can rinse the mouth or use sugarless gum to help remove food from the teeth.